Did you know that in America, a single trip to the emergency room can cost more than a round-trip flight back to your home country? Yes, thousands of dollars, just for a few hours and some bandages. It's shocking, right? As a newcomer, figuring out health insurance in the US can feel like solving a puzzle with 10,000 missing pieces. But today, I'm going to help you crack the code and avoid potentially life-changing medical bills. Welcome to Moving to America, the channel where I, an immigrant who's navigated these challenges myself, give you practical advice for building your new life in the United States. If you're thinking about moving here, or you've just arrived, you probably already know that health insurance is not just a nice to have, it's absolutely essential. In this video, I'll break down how to get US health insurance as a newcomer, step by step. We'll cover the main options, the hidden traps, and real stories, including my own, so that you can protect yourself and your family. Even if you've never looked at US insurance before, stick around, because I promise, this could save you thousands. Let's start with the basics. Why is health insurance in America such a big deal? Unlike most other countries, there's no public healthcare system for everyone. If you get sick or injured and don't have insurance, you're responsible for the full cost, and that can put you in debt for years. Imagine paying $3,000 just for an X-ray or over $12,000 for a night in the hospital. Scary, right? That's why, as soon as you land in the US, your number one priority should be sorting out your health insurance. So, let's get down to the options. Generally, as a newcomer, you have four main ways to get health coverage in the US. Through your employer, buying it yourself on the marketplace, getting short-term and travel insurance, or qualifying for government programs. First, employer-sponsored insurance. This is the easiest and usually the best coverage you can get. If you're coming to the US on a work visa, like H-1B, L-1, or through a company transfer, your employer will often offer health insurance. These plans usually start on your first or second month, can cover your dependents, and have much lower monthly costs because your employer pays a portion. But don't assume you're automatically enrolled. Check with your HR department immediately after you get your employment letter. Some jobs have a waiting period before the insurance kicks in, so you may need temporary coverage for a few weeks. Second, the health insurance marketplace, also known as Obamacare. This is the main way individuals and families buy health coverage if your job doesn't offer it. Now, as a newcomer, you can only use the marketplace if you're a legal resident. So if you're a green card holder, have certain visas, or have qualified non-citizen status, you can enroll. The enrollment period is usually November to January, but if you've just arrived, you qualify for a special enrollment. Go to healthcare.gov, put in your information, compare plans, and check if you can get financial assistance. Here's a plot twist. Many immigrants don't realize they can get subsidies, which can make insurance surprisingly affordable. Now, let's talk about buying directly from insurance companies. If you're not eligible for the marketplace, for example, you're on a tourist or student visa, you can get coverage from private companies. These are sometimes called off-exchange plans. They can be tricky. Premiums, deductibles, and coverage options vary wildly. Always read the fine print. Some plans exclude pre-existing conditions or certain treatments. My tip? Use comparison websites like eHealth Insurance, or talk to a licensed broker who works with international clients. Don't just click on the first cheap offer you see online. That's how people get scammed. Third, short-term and travel insurance. This is perfect for people who can't get employer or marketplace coverage yet. Maybe you're waiting for your work papers, or you're a student or visitor. Short-term insurance is usually cheap and starts immediately, but beware. It often doesn't cover pre-existing conditions, maternity, or anything routine. If you have a pre-existing condition, Let's say you're diabetic or you need regular medication. Short-term insurance may not protect you as much as you hope. For students, your school might require you to buy a specific plan. Always check with them first. Now, some newcomers may wonder about government programs. There are a few, but most have strict eligibility rules. Medicaid is healthcare for low-income residents, but you usually need to be a green card holder for at least 5 years or have other qualifying circumstances. Medicare is for people over 65 or with certain disabilities, so not likely for new arrivals. Children in some states can get coverage more easily through CHIP, Children's Health Insurance Program, even if parents aren't eligible. If you have kids, definitely check your state's CHIP rules. Here's something I wish someone had told me. In America, where you live affects what options you have. Each state has different rules and plans. For example, some states have expanded Medicaid to more people, while others haven't. Before you move, research the state you'll land in. New York, California, and Massachusetts are much friendlier to immigrants than, say, Texas or Florida when it comes to health coverage. Let me share a quick story. When I first arrived, I thought, I'm young and healthy, I don't need insurance yet. Literally, 2 weeks later, I slipped on the ice and needed stitches at urgent care. The bill? $1,400 out of pocket. If I'd had even the cheapest insurance, it would have cost around $80. Don't make the same mistake I did. Even a temporary insurance plan is far better than none. Here's a unique insight. Many immigrants pull together for health shares. These are like community funds where everyone pays in each month and the group helps cover big expenses. These aren't regulated insurance, but for some, it's better than nothing. Just be aware, they don't guarantee coverage. At this point, you might be wondering, how do I actually sign up? My best advice? Make a checklist. Gather your documents, passport, visa, proof of residence, and income information. Go online, read reviews, and don't be afraid to call customer service and ask questions. A 30-minute call can save you thousands later. And here's the wildest fact. Going uninsured in the US can also impact your immigration process. Some kinds of visas and green card applications ask if you have adequate health insurance. Not having it could cause delays or even denials. So, to recap, check if your employer offers insurance, see if you're eligible for the marketplace, compare private plans, consider short-term or travel insurance, and always double-check your state's rules. Protect yourself and your family from day one. Before you go, I want to hear from you. Are you moving to the US soon? Or have you already arrived? What scares you the most about American healthcare? Or have you had any insurance nightmares? Leave a comment below. I reply to every story, and your experience could help someone else. And if you found this helpful, please give it a like, subscribe for more newcomer guides, and share this video with friends who need it. Remember, facing the US healthcare system is tough, but you don't have to do it alone. Welcome to America. Let's build your new life together.